It's Amy, the Skin and Lash Lady, and welcome back to my bathroom. Tonight I'm going to demonstrate how to do microneedling, the same protocol that I would do if you were coming in as a client to my shop. The only difference is that in my shop I use a RejuvaPen, which is a professional level microneedling device, but it's not available to non-licensed professionals. So I'm going to go through what I've purchased. I'll link everything below, and then I'll show you the protocol. So the pen that I purchased is the Dr. Pen, and it's the Ultima M5. And this particular model has a 12 needle, it's called a 12 needle. They also have a 36 one, but I didn't want the 36 one because in my Pro Pen I only use a 12. I do not like a lot of needles. 12 is plenty. It also has a nano tip. I think it's somewhere in here. And a nano tip is used to infuse product, but I have a regenerator, so I may use this at another time. It also came with latex gloves, which I don't use latex. A lot of people are allergic to it. And this is what the pen looks like, so it's ready to go. I'm going to put that aside. The other thing that I'm going to use is Numb Master. And this is the same numbing cream that I use in my shop. And the reason why I like Numb Master is that it is water soluble. I don't want an oil-based numbing cream. This is 5% lidocaine. It takes about 10 to 15 minutes. I do not want to have, I don't want to be pushing the product into my skin. So I'm going to put this on and I'm going to put the timer on and then I'm going to wash it off and then start my needling. But I can't needle on dry skin. You need to have what's called slip, because we don't want to create any drag with the needle. That can tear skin. So I'm going to use my Moisture Glide, which is also being I use for my microcurrent and my LED. It is hyaluronic acid serum, which is safe to needle into the skin. We never want to needle vitamin C or any acids or anything. You'll have reactions. All we want to do is needle to the point that's deep enough that the skin becomes red. It's called erythema. So more is not better. I would wash my face again, and then I'm going to put on my Victorian Peptide Repair. This isn't necessary, but this just helps to take the redness down. I may sit under my LED light, I'm not sure, but this product is used after laser, microneedling, dermabrasion to help the skin calm down. And I also have nitrile gloves because I would never needle myself or anybody with uncovered hands. So I'm going to tell you more things while I get my skin prepped. So who can and cannot, I'm such a klutz, I just dropped the cap. So usually what I do to put it on is I take 2 Q-tips like this, and this is how I put it on. I'm going to look in the mirrors because the camera is backwards. So who can and cannot have needling? If you have active acne, no, you're going to spread your acne. I know people have acne scarring and they're anxious to get their acne scarring under control, but if you have active acne with breakouts, no. If you have severe rosacea, this is not the treatment for you. If you have excessive amounts of broken capillaries, also, I have a broken capillary right here on my upper lip. I'm actually going to not do it there. Now, I have tattooed eyebrows, so I'm going to actually stay away from that area. And I'm not going to be needling that. Doesn't need to anyway. Do not get this stuff in your eyes. Now, I do go a little bit on top of the lip line. You cannot needle on top of your lips. They are full of blood vessels. I am going to pull it down lower onto my neck, even though I'm not going to be needling my neck. So here are some key things to remember. We want to get what's called erythema, meaning we only need to needle until we're just pink. I'm going to put the timer on. The numbing creams many times have vasoconstrictors in them. So after it wears down, a lot of people will flare very red. So that's just how it happens. What'll happen is that the needling causes a injury response, and so the skin is going to start producing collagen. It is called a histamine reaction. So your skin will swell or get tighter, And a lot of times what happens is afterwards you may get some flaky or peeling, and that's just normal. Not everybody has it, but it could happen. Now, after you needle, you don't want to put on vitamin C, you don't want to put on retinols, you don't want to put on acids. I ask all my clients, I send them home with a coating of Aquaphor and a little jar of it, and that's what they're going to use till the next day, because I really just want the skin to not have anything on it that can cause an irritation or allergic reaction or anything. No fragrance, no nothing. I want you to put on a clean pillowcase after as well, because we don't want any bacteria or anything coming into the skin. Now, the skin stays open for about 20 minutes, but still, I always err on the side of caution. You just never know. So I always tell everybody, like, put on a clean pillowcase when you go home. Don't hug your animals and pets. They have dander. They can have something on their fur. We really just want the skin to stay as clean as possible. The next day when you wake up, just a gentle cleanser. I use my Glymed skin recovery mist that I talk about all the time, because the skin is going to need a lot of hydration, and I really just use Aquaphor on it for the next day. By the third day, I'm pretty much okay, and I can start putting my peptide serums on. But once again, you know, every individual is different, so I may not be putting on a vitamin C product or anything that can irritate it. We want the skin to really not have any challenges. So I always err on the side of caution. So I'll be back. I'm going to let my numbing cream. Okay, so my timer went off. I'm putting on my gloves. I'm going to wash off, just using a couple of 4x4s. My lips are numb. And I'm wiping it off with warm 4x4s. I don't want to wash my face in a traditional manner because I don't want to get the numbing cream in my eye. So this is enough to get it off. Okay, this is my first time using the pen, so let's see how I go. So it's all sealed. Works a little different of how to twist it. I have it set on 0.5. I'm going to go a little lower. One of the reasons is that in my Pro pens, the one thing I always notice is that the Rejuva needles are like $25 a piece. They're honed really well. Some of these, they're not made as well, so they could have little spurs on it, so I'm not going to be like super aggressive, so I'm going to turn it down. So a few things. So on my glove, I always put my gel, and you always want to start on the most fleshiest part, so that way you can get adjusted to it, because microneedling on areas of the bone is much more like not comfortable. This has several speeds. I'm going to keep it on the lowest speed because I don't want to create a lot of drag or rip the skin. So usually you pull the skin a little tight. Now I don't, well, maybe I will get red. I can go a little bit deeper. I don't believe in going so fast. You can hardly see the numbers. That's the other thing. On my Rejuva pen, you can see it a lot more. So I'm getting red. Now, let's say, see, until I pink up. So I go in circular. I can go up and down. Circular is usually the easiest. And I like to pull the skin. And if I'm in an area that's getting dry, I just put a little bit more slip on. It would be really uncomfortable on dry skin. Now, I'm going to avoid right now my eye areas simply because I'm going to do something different there. I'm going to do a stamping technique. I'm going to look in the mirror. It's just a little easier. I think I'll look on that mirror so you guys can still see. As well as I'm not going to do my upper lip right now because I'm also going to do it a little, I'm going to do differently. So I'm pinking up. Now I do feel a difference in the pen from my Pro pen. The needle is not as honed as well, but it still will do the job. Now I do this. My needling should not be done like 4 to 6 weeks. It takes This is my area that I have old acne scarring, so I'm going over it a little bit more. It takes 4 weeks, 28 days on average, 28 to 35 days on average for skin to like recycle itself. That's just the way it works. I'll go this way now. So because I'm going to change my needle depth, I do all the larger areas first with the deeper needle depth. But remember, I only want to go to where I'm pinked up. I don't need to go. And if you get a little pinpoint blood, that's okay. But I see all these people online, they get so aggressive. It's not necessary to be that aggressive. So I'm going to look in the mirror. It's just easier than looking in the camera. Now I had a little ingrown hair there that I pulled out this morning. So I really have to like not go around that area. I have not needled my skin in like 2 years. Isn't that horrible? That I do it on all my clients all the time. So also needling is something that it's best done in a series. So normally if you are my client, and I always sell a series, we would always start you off with microcurrent first. And then probably about the third session you would come in and you would get a needling session to help boost the collagen. But some clients don't want downtime. They don't want to be red because you can't wear makeup or anything right after. So Friday was like needling day in my shop because everybody would be off for the weekend. I do a little bit in my nose on the side because I do have some old scarring. Okay, now I'm going to lower the needle depth because I'm going to go around my eyes and my upper lip. And I don't need it that aggressive. So we're just going to take it down a little bit. And this, we're going to do stamping. It's just much more comfortable. So normally, pull the skin. And you're just tapping, tapping, tapping. Because even though I'm numb, it's a little smart. Do not go over your lips. Just go as close as possible to the vermilion line. You get this. Now I have a broken capillary there, so I'm going to avoid that area because I don't want that capillary to get any worse than it is. Now I calm down really quickly from redness. Some people, it depends on the person. Sometimes my clients will come in, they'll go, "Let it rip, Amy, I don't care." But I just get it to get to the... Now I'm going to do the same thing around my eyes. Need a little bit more slip. And I don't want this fast. This is on the slowest speed. It's the same thing. We have capillaries here, so I tend to pull down the skin. Small little taps. It smarts a little bit. But I could have left the numbing cream on a little bit longer if I wanted to, but I have high pain tolerance. And same thing, I'm going to go up. Don't go on the eyelid, but I want to get those crow's feet. I always save the forehead for last because for most people, it is the most uncomfortable area. And if it's your first time needling, always err on the side of caution. You know, like you don't have to be super aggressive. People think it has to hurt to work or be really aggressive. It doesn't. Especially if we're older and our skin is sensitive or it's not used to it. Like I said, underneath the eyes, it's very fragile. So I'm just pulling it down because I can't work in the pocket area. Do what, you know, like, just common sense. And just the tapping motion. This is called stamping. I want to get in here because I have those bunny lines. And I'm also stamping here. And usually when you hit the forehead, the sinuses are there. I guarantee you I'll sneeze. I can't tell you how many clients when I work on them or when I'm doing eyebrow tattoo, they're like, I'm gonna sneeze, I'm gonna sneeze. When I got off of Accutane and I had a lot of acne scarring, pens weren't available. It was only rollers. And I would go to the dermatologist and they would use the roller. And the reason I don't like rollers is that you have to clean them well, but a lot of people are careless and the rollers can rip and tear the skin. So the pens and the stamping are much safer on the skin. Now, I have that wrinkle here that I've had since I'm 23 years. So I'm just going to go over it a little bit more. It's not that complicated a procedure. Now, some people say, do you do the neck? When you come into my treatment room, I do the neck. I avoid this whole area. And I'll probably go back and do a little bit more under my chin at a little bit of a deeper depth because I'm fleshier here. So I'm only at just below, I'm at a 0.03 on my forehead and my eyes. And I can go, slip here, go right here. Not so bad, not so red. Now, I'm gonna put some slip. Now I have some lines here and I may go in and do them, I may not. The neck gets a little itchy, but you see I'm already calming down because we don't need to be that aggressive. And I'm just doing circular motions. I prefer the circular motion, small circular motions, but you could do like this as well. And that's pretty much it. I can go back in and do more into my ears and all of that. This is disposable, so I'm going to dispose of it. In my shop, it goes into a Sharps container. This gets cleaned off. Now, my skin is full of the hyaluronic acid serum. So, now normally I would just take my cleanser if I wanted to, a mild cleanser, and wash it all off. I could sit under my LED light now if I wanted to and put more of this product on. But I'm not going to do that because it will take too long on the video. But those are options because an LED light will also help. It's a good combination to use your LED light now after this. I'm going to take off my gloves. There is a professional way to take off gloves. I'm going to use my repair serum. My skin is still tingling and my lips are numb, but it is tingling. And that's pretty much it. I'm going to change my pillowcase. Tomorrow morning when I wake up, I'm just going to cleanse with a neutral cleanser. I'm going to use my Skin Recovery Mist, my Glymed product that I love so much because it's going to put hydration into my skin. I will use a light coating of Aquaphor. I will not be wearing makeup. I always ask my clients, no makeup for 24 hours or mineral-based makeup. And that's it. It's not that complicated. So like I said, my redness is starting to come out a little bit more, but it's not supposed to be something super aggressive. So I tell everybody, you just have to get until your skin is pink.